Preventing measles, polio, and whooping cough. Doctors say it's as simple as getting a shot, but fewer children are getting vaccinated, leaving some communities vulnerable to outbreaks of preventable diseases.
Yeah, investigative reporter Tracee Wilkins is taking a deeper dive into the local numbers and shares a warning from health officials as the new school year begins.
As students head back to school, doctors are sounding the alarm about an old disease making a comeback. Dr. Gabrina Dixon is with Children's National Hospital in D.C.
As a pediatrician, I'm highly concerned. We should not have kids die from measles in 2025, and so it's heartbreaking.
Measles cases hit a 33-year high in the U.S. this year. 3 people have died and more than 1,300 others have gotten sick. 25 years ago, measles was declared eliminated in the U.S. by the CDC.
And we can prevent this, and the way to prevent it is with vaccination.
Dr. William Moss and his team at the Johns Hopkins Bloomberg School of Public Health have been tracking the measles outbreak from the start in real time. He says the crisis we're seeing today is years in the making and worries it will only get worse if vaccination rates keep dropping and more jurisdictions loosen the rules on vaccine exemptions for students.
Those school entry vaccination requirements have been so critical to controlling vaccine preventable diseases in this country and protecting our children. So that's where I'm concerned, is that we're going to see more permissible non-medical exemptions that will further undermine our ability to maintain sufficiently high vaccine coverage among our children.
And that's the bigger issue, because it's not just measles. According to the CDC, national kindergarten vaccination rates for required vaccines like MMR and DTaP have fallen from pre-pandemic levels of 95% to around 93%, while the number of families opting out of vaccines for medical or religious reasons has increased. We checked vaccine rates for kindergartners in our region last year and found Montgomery and Prince George's counties were at 95% and higher, with more than 1% of students with religious exemptions. Loudoun County, Virginia was at 94%, followed by the District of Columbia, Arlington, Fairfax, and Alexandria City. What happened in this country that suddenly there is this vaccine skepticism that we didn't see before?
The COVID pandemic did play a role in undermining public trust among some people and communities, and social media and the polarization within social media. And then what we've seen now with the new administration is that some of the more stronger, outspoken voices, the anti-vaccine voices, are now leading the institutions that are supposed to be protecting us against vaccine preventable diseases.
One of the most outspoken critics of vaccines has been Robert F. Kennedy Jr., who now serves as the U.S. Secretary of Health and Human Services. In the past, he has promoted debunked claims linking vaccines to disorders like autism, a claim doctors have repeatedly denied. We reached out to HHS for a statement, and they tell us, quote, Secretary Kennedy is not anti-vaccine. He is pro-safety, pro-transparency, and pro-accountability. The agency says the decision to vaccinate is a personal one. Parents should consult their healthcare providers on options for their families, adding that vaccination remains the most effective way to protect children from serious diseases like measles and whooping cough, which can lead to hospitalization and long-term health complications. How long can a community like Maryland sustain if there are multiple cases, and how long does our vaccination saturation last?
Yeah, this is something you have to continually work on, because there are continued, children being born and growing up. They are susceptible to measles until they get vaccinated.
And that's why doctors are dispelling the misinformation with science and the mountain of evidence that's been proven to support these life-saving shots.
There's no long-term side effects from the vaccine. It has been proven again and again to be a very effective vaccine. The counter to that, if you don't get the vaccine and you do get measles, it can lead to death, and we have seen that.
2 shots of the MMR vaccine offers a lifetime of protection from measles. There have been 6 measles cases in our area this year, all are what experts call imported or travel-related cases brought into the DMV. And doctors say we haven't seen a spread of it because of our high vaccination rate. So I look at this kind of like, you know, it's a group project, right? We want to get an A because this is what helps for the good of public health. We're coming at an A minus. On our way to a B. So we just, you know, it's all in on our numbers to keep us to have that saturation that we talked about. The ability for us to have herd immunity is super important. The more folks who are vaccinated, the better. And we're really looking at those kindergarten numbers to make sure that they stay where they're supposed to be. And 95 is the ideal mark.
Yeah, and we know local school systems also try to provide fairs and clinics so that parents can bring their kids to get their vaccinations before school starts.
Absolutely. It's so important. And then if you don't, you can get thrown out of school after a certain number of months. So it's really important that it's done and that you make sure that you have your child vaccinated.
All right.
Yeah.
Well, Tracee, thanks so much.